So about 3 months ago, my good friend Barry got Smile laser eye surgery. It was the same type of laser eye surgery that I got about 6 months ago. After he saw how well it worked out for me, he decided to get it for himself. And in today's video, we're gonna see how well he's been doing after 3 months. I was able to catch up with Barry and have a conversation with him explaining to me what it's been like these past 2 to 3 months, any side effects, all the pros, the cons. We discuss it all in this short little conversation, so please enjoy. So how you been, buddy?
I've been good. Everything's good.
You've went through a pretty big life change recently.
That's right. Laser eye surgery.
Laser eye surgery.
Smile.
What does SMILE stand for?
I have no idea.
You don't know. I don't know either. I think it stood for small lenticular,
I think it's small, minuscule, invasive
lenticular eye surgery. Yeah.
Something like that.
Who knows? But basically, SMILE is the combination of LASIK and PRK.
Mm-hmm.
It's like the best of both worlds, right?
Mm-hmm.
And when did you get it done?
I got it February 28th of 2021. So it's been about 3 months.
So it's been over a month.
Mm-hmm.
What was that first week like of recovery time for you?
It was odd to adjust, if it makes sense, because I went from wearing contacts and glasses on a regular basis to now not needing either of them. First day, I was just more exhausted because of the experience of what my eye went through. You know, the procedure itself is just exhausting on your eyes. They feel a bit heavy. I was just really tired the first day. But then following those days, I actually felt pretty good. I had dry eyes, though, so I definitely utilized the artificial tears and the... can't recall what it was.
Oh, so you have the artificial tears and then the two, those two drops.
Why can't we think of
antibiotics?
Antibiotics,
yeah.
And there was another one. I forget what the other one was.
Antibiotics, and...
Is it a steroid?
Yes. I think
it was a steroid.
I think they were calling it that.
Yeah.
There's two other droplets that you're supposed to drop in.
Mm-hmm.
One was like a white thing.
Yeah, you got it.
And then the other was antibiotics, just to prevent any type of...
infection.
Exactly.
Mm-hmm.
Okay. So yeah, you did that just for a week.
Yeah, just for a week. That's all I really needed. Mm-hmm. I didn't feel, really any need to continue onward using them. The only thing I kept using even after a week, even now actually, is the artificial tears, because I do have, according to the doctor, dry eyes, because I did have my checkup today before I came to see you. Mm-hmm. So far so good though. They just said use the artificial tears as needed.
So when you went on that 1 month checkup that you just came from, 2 months later,
mm-hmm.
what did they say? They said...
So far vision is still good.
Vision's perfect?
Yeah.
Are you 20/20? Are you 15/20?
I am currently 20/20.
Which is
actually
great. Perfect vision.
Yeah. As of right now, I'm 20/20. The one thing that I did ask her to touch upon is because I am experiencing one side effect, and she did elaborate on it.
What side effect
takes
is
6
that?
months. The side effect I currently have is the starburst effect.
Okay.
So I'm unaffected by it during the day. At night, though, when I look at certain lights, there's a small glimmers, if you will, of light that I can see. So
it's like literally like a starburst. Looks
yeah,
like
it's literally a star
around the light.
Yeah.
Like if you looked at a traffic light,
you
would see stars around each one of those.
You got it. Yeah. So it's not distracting. It's more so it's just you don't expect yourself to see that way. Mm-hmm. So I have no issues driving at night or anything of the sort. It's more so that I just noticed that as one of the side effects. And the doctor elaborated, and she said it will be gone usually by the 6 month mark or before.
That is definitely a common side effect that I've seen on the web. People said they've had that. It's usually dry eyes and the starburst.
You got it.
When I went through this personally, I did not ever go through that starburst effect. But I did have some dry eyes. And I was going to ask you how you're still using the artificial tears now. Because when I went through it, I think I got mine done 5-6 months ago now. But I remember, I think up to month 3, I would still just keep use those eye drops. Because one, you bought them and they're just sitting there. And two, it's not bad. It's literally like drinking water for your eyes. So I kept doing that for about 3, maybe 4 months. Even to this day, if I'm staring at the computer screen all day, I'll pop them in. If I notice I'm not blinking, if they're a little dry. But you're still using them today, right?
Correct.
Correct. How often or why?
The same as you, because similar to what you do, I am also in front of a computer or my phone a decent amount, because that's one of the ways we make our living. I will definitely say that the doctor actually recommended something I didn't even think of. So how when you have an injury or something, they usually say put an ice pack on it. She actually recommended to me today is to put the artificial tear packets into the refrigerator, because the coldness will help the swelling go down if there's any swelling. I didn't even think about something so simple like that.
No,
I
she
didn't
never
even think
mentioned
about
that. Never told that to me.
Yeah, because I told her about the starburst effect and everything, and she said, "Hey, have you ever, thought about this? I usually recommend this." And I said, "I didn't even think about it. I'll give it a try." Exactly.
Okay. That's interesting. Well, I wouldn't say that our eyes are still swelling.
Yeah.
But I think that could have been useful in that first week.
Exactly.
Because they were still in that healing process back then. I mean, so that's really it for your cons, if we want to call them cons. You haven't seen any other side effects?
I have no other side effects. So as of right now, I still highly recommend it. It's still fantastic that I have it. And I'll give you just a couple of examples when it comes to sports, you know, because some people choose to wear contacts, some people choose to wear glasses. For those who usually wear glasses, it's more of an inconvenience for them when it comes to playing sports because the glasses fall, especially if you're playing contact sports, basketball, football, rugby, any of those sports. It's difficult for an athlete to play those sports when they're wearing glasses. You know me, I play rugby. I recently went snowboarding twice, and as of right now, I don't have the issue I had when I first went snowboarding because I went snowboarding the first time before I got the laser eye surgery and after. And I had to wear my glasses when I went snowboarding because my Lasik surgery was about 5 days after I went snowboarding. So they recommend not wearing your contacts a week before your surgery. So I had to wear my glasses when I went snowboarding.
Okay.
So now when I do anything, it's a luxury and a pleasure that I no longer have to wear my glasses or contacts. And it's really nice that I just wake up and start the day compared to, all right, waking up, search for my glasses or putting my contacts in, which it doesn't take long, but after so long of doing it, it gets tiresome.
Of course.
So now, you know, just wake up. Well, today, for example, woke up, brushed my teeth, showered, got in the car, done. Didn't have to worry about my contacts, nothing like that.
It's definitely something, it's a luxury that you never knew you had for all you people out there that don't wear glasses and have perfect vision. But for you and me who have worn glasses or like corrected vision all our life, to just suddenly not have to do it anymore, you think like, how did I live my whole life like doing all of that? Like, that's insane. And I love it. Like to this day, it's like the best decision I've ever made for myself, like the biggest investment in myself, completely worth it. And would highly recommend to anybody, if you're applicable, you know, do your consultation. And if you're financially in a good, comfortable spot to do it, I would highly recommend you do it. Would you agree?
I would definitely agree. The main concern I feel most people will usually have is one is price and the experience. Price, they're willing to work with you. You know, most companies usually are. How often people buy contacts and glasses, but it does get pricey over the years compared to this company that me and you both went to.
Lasik Experts down in
Plymouth Meeting.
Dr. Chirag.
You got it.
Sorry, I'm not pronouncing that right, but highly recommended. If you're in the Philadelphia area, please go there.
So one of the things that we definitely liked about the company is not only do they have a payment plan, but also they give a lifetime warranty.
That's true.
And that's the number one thing that really gave me the push to go do it, not only because I trust you as one of my best friends, but also because it's just having that warranty and that basically
that
insurance,
peace of mind.
That insurance saying, okay, look, if we made a mistake as a company, we will fix it. There was really no con to going through with the procedure.
No, I totally agree. That with the free consultation, which most places do offer, do that first, see if you're a candidate, and then after that, see what your options are. You have between LASIK, PRK, and Smile. You and I went through Smile, the newest and latest, even though it's really like 10 years old still. Like it's new, but it's been around for a while. Quickest recovery time. I was good the next day. We were both good after the surgery. If that's something you guys are looking into, anybody out there, highly recommend it. Yeah, so now you're done. You're moving on with your life, and you have perfect vision.
Yeah.
You and I both.
One thing I will actually elaborate on, though, is because I don't know if we talked about this in the previous videos, but it's actually about allergies.
Okay.
So I myself, I have seasonal allergies. My allergies usually start when the transition of the cold weather turns to the hot weather. So around usually between April and June.
Yeah,
really,
like right now.
Yeah, is when my allergies start to kick in. The runny nose, the constant sneezing, the itchy eyes, the possibility of having pink eye. Those things happen around this time between about April and between about June when the transition happens with the cold to hot weather.
And how is that affecting you with the...
So that's the thing. It doesn't affect my vision whatsoever. It's just more so the inconvenience of having allergies. So for example, a perfect example actually is the dry eyes, because your eyes get dried out when you have allergies. Most people use, eye drops for allergies. I believe it's called Zydidor and Alway. They're eye drops to help people with allergies. I also use Flonase and all these other types of things, Claritin as well, to handle, the allergy season. I have been using the artificial tears a bit more because my eyes get so dried out because of my allergies. So that's definitely something I want people to know going forward with it. If anything, I would recommend if you have seasonal allergies, in the months that I just listed. I would say do it maybe around the colder weathers, Christmas time, January. I would highly recommend most likely around November, December, because you don't have to worry about the transition.
Gotcha.
Depending on where you live, because we live in Pennsylvania, so we experience all 4 seasons. But if somebody lives in California, Texas, they may not have the issues that we have, because my experience visiting there, it's usually the same weather all year round.
And this is pretty dependent on each person, because someone else who gets this may not experience it like you did. Like, I have no allergies. I never went through that. I did have the dry eyes, but that's a common thing, and it went away pretty quickly. That's a good topic to bring up. So whoever out there that has allergies and was worried about that, now you know.
Yeah.
Anything else you want to talk about?
Other than that, full transparency, the team they have at Lasik Experts, they're a great set of doctors. All in all, I would still highly recommend it. I'm glad I got it. And actually, believe it or not, most people actually are curious of it, but they don't know anyone who has gotten it in their circle of friends or people they know. Actually, I had a get together about 2 weeks ago. A friend of mine, she actually asked, how was the experience? Because she's been thinking about it, but she doesn't know anyone who experienced it. So I, basically put the bug in her ear. I said, hey, I got it. I'm okay. This is month 2 going on month 3. And so far, so good. The only issue that I had is a starburst effect, but that's to go away in about a few months or so.
Hopefully you referred her to our YouTube video describing your experience.
Of course I did.
Of course. Perfect. Then you can refer her to this one too.
You got it.
Yeah, I get that too. I was telling someone, I was doing a grad shoot the other day, and I was telling them how I got it. I don't know how it came up, but they're like, yeah, I've been looking into it for so long, but I don't know anything about it. And I'm like, oh, you should look into Smile. And always, they're like, what's that? And I'm like, basically PRK mixed with LASIK, and it's like the best of both worlds. And once I start telling about it, they're like, that sounds amazing. And then I put the bug in their ear. Hopefully they go through with it. Yeah, just spread the word of Smile, because I love it. Good stuff, buddy. Well, I'm happy everything worked out for you. Happy it all worked out for both of us. We're both seeing perfectly fine. Never have to wear glasses again. It's a blessing for sure. Who knows? Maybe we'll do a 6-month video update to see how we're doing.
Oh, that's what I forgot to add on. So I actually did all the appointments they recommended. So I did the day after, the week, the month, and the 6-month is in August.
Wait, is there an actually 6-month update?
So she just recommended it, especially for me, because I still have the starburst effect.
That's true.
So that's why she recommended me do that final follow-up appointment. Yeah. So I have that. I believe it's August 3rd.
Okay.
I have it.
Good. So we will definitely do a 6-month update to see how you're doing with that.
Yeah.
All right, buddy. Well, thanks for stopping by.
Thanks for having me. Always a pleasure.
Always. Boom. All right. Well, I hope you enjoyed this little interview podcast style video. I think it's a great way for any people out there who are considering looking into Smile laser eye surgery or any type of laser eye surgery to get a first person view and perspective from 2 people that have gotten it themselves very recently. As you heard through our conversation, it's not all sunshine and rainbows. There are things to look out for and things to be worried about, as with any major life surgery that you may decide to have. Anyways, I hope you guys found some type of value in this video, and if you did, I would highly appreciate it if you could like the video, comment any questions you have down below, and subscribe for the journey. Because why not? And boom! Look at that. See? 14 minutes. Easy stuff. Yeah. Don't you like how good you sound, though?
It did sound really, really crisp.
It sounds
I really like that.
I love it.
I felt like